Good morning and welcome to the Mega News at 6 here on MBN TV. We are coming to you live from our studios on the 10th Avenue, Nungwa Greater Estates. We are streaming live on our social media platforms on YouTube and Facebook at MBN 360. I am Farah Ayi, coming up in the major headlines.
Coming up in the headlines, the government says it has procured 24,534 pieces of medical equipment as part of preparation for the rollout of Ghana's free primary healthcare policy. In business, government lost more than 600 million Ghana cedis in tax revenue in 2025 due to 199 million liters of unaccounted for petroleum products, according to the 2025 Petroleum Product Analysis Report. On the international front, Nigeria Air Force says it has launched an investigation after dozens of civilians were reportedly killed in an airstrike on a market on Saturday.
And now in our first story, the government says it has procured 24,534 pieces of medical equipment as part of preparations for the rollout of Ghana's free primary healthcare policy.
Health Minister Kwabena Minta Akando announced the government accountability series, describing the procurement as a key step towards equipping health facilities ahead of implementation. Mr. Akando said the equipment forms part of the efforts to retool health facilities to support the shift towards stronger primary healthcare delivery. He explained that the government is prioritizing CHPS compound health centers and polyclinics as the first points of their care under the new policy. However, details on the specific items procured, distribution planned, and the timelines for delivery to facilities were not immediately provided. The free primary healthcare policy is expected to be launched by President John Dramani Mahama in the coming days, with rollouts beginning in 150 districts before nationwide expansion by 2028.
The government has taken concrete practical steps to ensure that free primary healthcare is not only announced, but will be delivered efficiently and effectively. In preparation for implementation, we have procured and are ready to deploy 24,534 pieces of essential medical equipment across the country. This is intended to ensure our facilities and health workers are equipped and ready for implementation. I've already indicated the equipment status of our health facilities in the country. So we can't just be announcing policies without preparing. So we need to retool our health facilities to properly equip them to face what is ahead of us. This includes critical items such as incubators to support neonatal care, glucometers to enable routine screening and management of diabetes, hospital beds to improve patient care capacity, and ultrasound machines to enhance diagnostic services, particularly for maternal health. Over the next 2 months, Ghanaians will begin to see this transformation in action. We will distribute equipment to all the 150 districts that will be part of the first phase of implementation. We will intensify community sensitization through town halls and engagement. We will deploy trained volunteers to support our community health workforce. We will establish over 350 container-based service delivery points in high-traffic areas such as, markets and lorry parks. Very soon, health workers and volunteers will not only be waiting at facilities, they will be in your homes, schools, churches, and workplaces, screening, educating, and supporting you to stay healthy rather than treating you.
The University Teachers Association of Ghana, UTAG, has issued a 14-day ultimatum to the government for the removal of its Director General of the Ghana Tertiary Education Commission, Professor Hamed Jinapor, and his deputy, Professor Augustine Oklo, from office.
In a petition to the president, the association accused the GTEC leadership of regulatory overreach, issuing non-lateral directives and adopting what it describes as a coercive administrative style. At a press briefing in Accra, UTAG National President, Prof. Vera Fiando, also called for immediate withdrawal of GTEC September 30th circular, which disaccredited some institutions. President of the University of Ghana chapter of UTAG, Dr. Jerry Joe Harrison, warned that the association may withdraw its services to detect or embark on industrial action if their demands are not met.
Also asked for that all existing post-retirement contracts entered into prior to the said directives be protected and allowed to run their full course without interference. We also seek that UTAG be included in all relevant consultative processes to finalize the LI for Act 1023 and any amendments of the Acts as may be deemed fit as time goes on. And we also demand that the status quo on academic year rollover for regular teaching and non-teaching staff be maintained pending the conclusion of what we'll consider lawful consultative and regulatory processes. We want to close by saying that UTAG remains highly committed to constructive engagement, dialogue, and genuine reform in the public interest. We are by this press statement, however, serving notice that if appropriate actions are not taken to satisfactorily address our demands within 14 days from today, we shall, upon further consultation with our rank and file, advise ourselves accordingly.
Now, the Chief Executive Officer of the Ghana Shippers Authority, Professor Ransford Jampo, has expressed optimism that challenges surrounding the rollout of the publican AI system will soon be resolved through dialogue and stakeholder engagements.
The introduction of the publican AI system, which is intended to streamline and modernize import clearance processes at Ghana's ports, sparked significant debate within the shipping and logistics sector. While authorities maintain that the system will enhance efficiency, transparency, and reduce delays, the implementation has been met with considerable resistance from key industry players, particularly freight forwarders. The pushback created tension within the port community, with freight forwarders and clearing agents directed to cease payment of duties and lay down their tools before Monday, April 13th to Friday, April 17th, 2026, as part of the Nation Trade Action declared by the Ghana Union of Traders Association, Gov'T. Speaking on City Breakfast Show on Monday, April 13th, Ransford Jampo disclosed that he has been mandated to spur discussions with the affected groups, including union leaders and other stakeholders, to find a way forward. The planned meeting is expected to bring together various stakeholders, including freight forwarders and haulage operators, whose roles are critical to the smooth functioning of the port ecosystem.
Trade by one of its key stakeholders that we tend to work for, we tend to protect, and we tend to negotiate in a manner that projects their interest. Section 26(1) of the Ghana Shippers Authority Act at 1122 says, no service provider can render services to shippers unless they are registered with the Ghana Shippers Authority for the purposes of regulating their activities. And so we cannot regulate the commercial activities of shippers as provided for by our Act and shipping service providers without knowing or registering them. So prior to the passage of our Act and after the passage, we held extensive consultations and meetings with all stakeholders about the need for them to be registered. You cannot regulate the activities of people you are working with if you don't know them. So at the moment, shippers, and I'm talking about here importers and exporters, are being registered. But shipping service providers like Gov'T are yet to be registered. Recently, we engaged their membership in Takoradi, Tema, and in Kumasi, and their leadership noted that they had already registered their members and that our attempt to re-register them will be a duplication. We agreed to discuss and resolve their concerns in line with the law. So it was therefore surprising when we saw in the news that they are communicating their intention to embark on a sit-down strike. I'm told they said they wrote to us, but checks at my secretariat show that no letter has been received from them. And yesterday, because of this, I held some telephone discussion with their leadership, and we've agreed that this afternoon at 12 p.m. we'll meet with all of them to look at their concerns and to see how we can address them. There is no cause for alarm.
Government has lost more than 600 million in tax revenue in 2025 due to 199 million liters of unaccounted petroleum products, according to the 2025 Petroleum Product Analysis Report.
The lost revenue was expected to accrete to the state through levies, taxes, and other regulatory charges on petroleum products imported into the country, but was not properly accounted for. According to the Chamber of Oil Marketing Companies, the unaccounted volumes represent 2.1% of the country's total petroleum supply for the year. The report provides a detailed examination of Ghana's petroleum product supply and consumption trends from January to December 2025 with a comparative analysis of 2024. It also highlights national and regional volumes, offering insights critical for market penetration and policy formulation. In 2025, imports of petroleum products increased by 36.7% to 8.71 billion liters, up from 6.23 billion liters in 2024. This growth was driven largely by strong commercial and domestic demand. Domestic refinery output, however, declined from 500,000 metric tons to 444,264 metric tons, reflecting operational challenges within the refining sector. Meanwhile, petroleum products exports rose from 524,603 metric tons to 658,500 metric tons. These exports were largely re-exported of petrol, diesel, and LGP to regional markets, including Burkina Faso, Mali, Togo, and other Sahel companies.
Away from Ghana, the Nigerian Air Force says it has launched an investigation after dozens of civilians were reportedly killed in an airstrike on a market on Saturday.
The strike happened at Jelly Market along the border between Borno and Yobe State as military aircraft were hunting Islamist militant, local resident, and Amnesty International says more than 100 people lost their lives. Authorities have yet to confirm the death toll, but some hospitals in Yobe State says they are treating those injured. In a statement, the Nigerian Air Force said it has sent a team to immediately proceed to the location on a fact-finding mission on the allegation. One of those receiving treatment at the hospital said he has gone to the market to buy animals when he was hit. Nigeria's military on Sunday confirmed the strike in a statement, saying it has targeted a location in Jelly long identified as a major terrorist movement corridor and a convergence point for Islamic State, West African province terrorists and their collaborators, describing it as a carefully well-coordinated plan and intelligence-driven operation. The military said it has successfully conducted a precision airstrike on a known terrorist enclave and a logistics hub located near the abandoned village of Jelly. It said scores of terrorists were killed in a strike, but did not mention any civilian casualty.
Thank you for watching with us. This is the Mega News at 6 a.m. on MBN TV, and we are still streaming live on our social media platforms on YouTube and Facebook. I am Farah Ayi. Thanks for watching.
Coming up in the headlines, the government says it has procured 24,534 pieces of medical equipment as part of preparation for the rollout of Ghana's free primary healthcare policy.